you'll get either 3+1 vitals or 4+1. That would be your breathing rate, your heart rate, your pulse rate, plus your blood pressure. Caesar is able to get 21 vital signs within 45 to 60 seconds. And the accuracy rate is 95 to 99%. In terms of the business model, we charge $20 or equivalent of $20 per session for general practitioner. And then for specialists, we charge $60. If you look at what we are currently paying in South Africa, it's actually 3 times the amount you see of the GP as well as that of the specialist. So effectively, we're coming in at a third of what we generally pay on an ongoing basis. Now, if you look at the current market size, the total addressable market globally is $84 billion. The serviceable market in Africa, that is $2 billion. And then in the developing countries, we are talking about $70 billion. The obtainable market in South Africa is $600 million. Our aim within the next 5 years is to basically get 30 million of that market size. You will see that as you move from South Africa to the African continent to the developing world and then the global, the scales are basically tipping against South Africa, the African continent, as well as the developing world. In the Western world, there is much more, that is addressable there. Now, what are the benefits of CESAR? There are numerous benefits, but we basically picked 3 for each. For patients, we do obviously remote medical, consultation. The service is secure and the data is encrypted. It's fast and cost-effective, and it's available to everybody. For those people who do not have the smart devices, we are going to be building mini clinics in order to address the issue of access, because it's all about access. I mean, for doctors, basically the screening becomes very easy. They don't have to go to a physical location in order to screen people, in order to diagnose them. We do that remotely. And then also the doctors, they are able to, to locate patients using GPS. And then they are able also to share the best practices with other medical practitioners remotely. Our strategy, basically, we communicate our services through the following, which is your traditional as well as your digital. Last one? Okay, just last one. Okay, so effectively, this is what we are looking for the investment in order to take this thing to the market. We finished the development at the beginning of the year, so we're only beginning to raise funding. These are the people basically behind this. Thank you very much.
Thank you, Caesar. Let's hear from the Pathology Network.
Hi, good afternoon. My name is Janine. I am here today to present to you the Pathology Network. The Pathology Network, or TPN as it's commonly known, is a health tech company that connects remote pathologists with hospitals, doctors and their patients to enable a diagnosis. So diagnosis is the missing element in a lot of our healthcare. It's the Pathology Network are based in Kenya, and we actually aim to help the diagnosis through a combination of 3 things: the history, the physical examination, and we actually come in the pathology and lab testing and imaging area. Slide, please. Each year, over 1 million Kenyans need a pathology test to diagnose cancer. These are unavailable in 95% of hospitals in Kenya. Thank you. This causes a diagnostic choke point. So we have these millions of patients that are waiting anything between 3 weeks and 3 months to get a diagnosis. This obviously, if we have the potential for cancer, it's causing a real inefficient diagnosis process. It's costing people a lot of money that they can't afford, and it's leading to a lot of wasted hours in pathology testing. Our solution, we've actually built a software platform, and we provide reliable quality diagnostic testing. We work with a network of hospitals to support them on our online platform. We actually coordinate the whole process. They actually take a sample. We actually then logistically deal with it through standardized pricing, optimized referral process, and we guarantee turnaround times, the TATs. This way we control the diagnostic choke point. Our solution gives them a diagnosis within 2 to 7 days. So this is efficient, transparent online processes, optimized workflow, and reducing the overall cost. We're saving the patient going for numerous tests, and obviously the efficiency, which will diagnose any illness they have the quicker they can. We currently have over 30 medical facilities that we work with and over 100 doctors. We partner with a logistic company, so they do all our collections. We have 3 partner labs, and we have 14 remote pathologists. And to date, we've actually produced over 15,000 pathology reports. We believe the problem that we're solving isn't just in Kenya and East Africa, it's actually global. We would like to connect obviously further with this. We would like to have more people to assist people in South Africa and South America. This is our team. Our founder is himself a pathologist, Dr. Joshua Kibera. We have a board, a chair, we have a chief technical officer, we have a pathologist on duty, and there's me over there. Currently I'm leading the sales. So we have a great team, and we have just actually closed a round of funding, and we're actually looking to open again in a couple of months' time. That's it. That's mine. Short and sweet. Thank you.
Thank you, Pathology Network, and thank you for sticking to time. We now have the Root coming to the stage. Good luck. 5 minutes.
Thank you. Good afternoon, everyone. My name is Dumela Moletsane. I'm from The Root. It's a South African bio startup. Next slide, please. We operate in the medicinal cannabis space. Our 2 operational units involve R&D as well as product development and sales. Next slide, please. And that's just an expanded overview of the specific segments within those units. Within the R&D space, we're currently focusing on synthesizing cannabinoids, synthesizing mushrooms, as well as utilization of AI in drug discovery. Within the product development and sales platform, we are busy putting together a product for epilepsy, one for diabetes, and we have an existing range, a ProNutrieve range, which focuses on immune boosters. Next slide, please. I think there is an opportunity, or there is a need for scientifically proven alternative medical products, and I think that's where we saw the gap. There has been a wave in terms of medicinal cannabis coming to the fore and serving as an alternative, and these are some of the illnesses that can be treated. Next slide, please. With regard to our team, I think we're fortunate enough to have a very diverse team, both based in the US as well as in South Africa. In terms of the advisory council, we've got Mr. Liu, who assists on strategy, commercial, as well as execution. We've got Dr. Phil Barr, who's based in San Francisco, who assists on the science and the technical, as well as Mr. Chabum Tombeni, who assists on legal and strategy. With regard to our technical partners, we've partnered up with Sefako Makgato, we've partnered up with Wits University, UCT, the University of Johannesburg, as well as the CSIR. Next slide, please. And then our service providers, we've got Asheville Botanicals, who are based in North Carolina, in the US, and that's an FDA-approved facility. We've also got Xeon Logistics, based in South Africa, but operate throughout the African continent. With regard to government and industry, we've got a relationship with the Department of Trade and Industry, as well as Epilepsy South Africa. And then, yeah, below there is also some of our value proposition. Next slide, please. With regard to traction, I've just mentioned the relationships that we have, both with academia, as well as commercial. And then one of the other traction points is a clearly articulated pipeline and roadmap. We are also currently in the process of submitting a dossier for one of our products, as well as filing a patent for one of the technologies. And yeah, that's it. Thank you.
Thank you, The Root. So we have our last startup that's pitching. It is Yadawi. No? Okay, so I'm told that Yadawi is not presenting. I'm going to thank all of the startups for sharing your time and your expertise and exciting innovations with us. We're going to take a little bit of a break, but we need you to stay put within this area, because next up we have a session on diversity in clinical trials, after which the startup stadium winner will be announced. So please stick around for all of this. We start the Diversity in Clinical Trials program at 17:15, 5:15. 4:15? Okay, so 4:15, pardon me. So 16:15, we're starting the Diversity in Clinical Trials session. So we're going to be taking a break to set up for that. Thank you very much. Cheers.